Will I say good afternoon? It is with pleasure that I attend this occasion of the inauguration of the Dialysis Center donated to Wuse District Hospital by Redeemed Christian Church of God. Permit me to appreciate the General Overseer of the Redeemed Christian Church of God, Pastor Enoch A. Adeboye, and his team of visionary leaders for the choice of a life-saving project as part of their Christian social responsibility at this time of rising number of cases of kidney diseases in the society. I recall with nostalgia our robust relationship with the Inner City Mission for Children, an arm of the Christ Oyakilome Foundation of Christ Embassy, for their immense support to our health system in the primary healthcare facilities as well, through the donation of the ultrasound machines to the primary healthcare facilities, and many more donations in support of the FCT response to COVID-19 pandemic. Today, we are here to witness the donation of a well-equipped dialysis center in Wuse Hospital by Redeemed Christian Church of God. Let me state very clearly that with this noble step, the church is beginning to play one of its crucial roles of caring for the downtrodden in the society. Ladies and gentlemen, this donation is an eloquent testament and fulfillment of the teachings of the Holy Book. In Matthew 25, verses 34 to 40, then the king will say to those on his right, "Come, you who have been blessed by my Father, inherit the kingdom prepared for you from the founding of the world." 35, for I became hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you received me hospitably. 36, naked, and you clothed me. I fell sick, and you looked after me. I was in prison, and you visited me. 37, then the righteous ones will answer him with the words, "Lord, when did we see you hungry and fed you, or thirsty and give you something to drink?" 38, when did we see you stranger and received you hospitably, or naked and clothed you? When did we see you sick or in prison and visited you? In reply, the king will say to them, "Truly, I say to you, to the extent that you did it to one of the least of these my brothers, you did it to me also." Today we will be able to say it clearly that this man of God and the Redeemed Christian Church is sowing a seed. For you are given to God as asked, and he will give back to you accordingly. May God bless you. It is worthy to note that the kidney disease, when detected early, can be managed and corrected. But at end stage, the patient is said to have lost 85 to 90% of kidney function. And this is not enough capacity to keep the person alive without medical intervention, such as dialysis or transplant. Prevalence of chronic kidney disease is noted to be on the increase in sub-Saharan countries and other countries in the world. This is linked to increased incidence of other non-communicable diseases, particularly obesity, diabetes mellitus, chronic inflammation of the kidney, and hypertension. Ladies and gentlemen, the FCT administration, in response to rising incidence of chronic kidney disease, by 2013 operated 2 public dialysis and intensive care units in district hospitals at Wuse and Asokoro. The Wuse was inaugurated first, while Asokoro unit was in 2013. However, I call for subsidized dialysis costs in these centers because with the economic realities, it is difficult for clients to bear the cost of this high-tech. And this high-tech life-saving procedure, which of course is in most cases, is a stopgap measure before kidney transplant is instituted. However, second Thursday of March each year is the World Kidney Day, and this allows for awareness creation and free testing for early detection of kidney diseases, especially in clients with hypertension and diabetes. Weight, urea, electrolysis, electrolytes, creatinine, and cholesterol levels checked with evaluation of proteins in urine, among others, are additional tests necessary for early detections, and this also under FCT we conduct freely to mark this day. Therefore, while urging those with existing kidney disease requiring dialysis to catch on the opportunity offered by the expansion of access in the FCT, I urge the Nigerian Association of Nephrology and all other health stakeholders and stakeholders to intensify public enlightenment activities, including but not limited to education on lifestyle changes, control of orthodox and traditional drugs abuse, to prevent and control kidney disease and other non-communicable diseases. Ladies and gentlemen, if we do not appreciate our own, that has done to us what we call miracle today. Miracle does not only stop at healing or physical magic or immediate exhibition of a healing process. But this magic today, by expansion of our cost and our rising, to be able to tend to those needing dialysis, is most welcomed and most appreciated by the FCT administration and by extension, all residents and indigents of the Federal Capital Territory. To Pastor Enoch Adeboye, at 80, we say, may the Lord bless you with more wisdom. Amen. Broaden your vision. Amen. Empower you more, strengthen you more, give you the capacity to reach out the more. At 80, a life well spent, but we need you more alive, well, strong and healthy, to continue to do the best you've been putting together in this country and beyond. For his teaming followers, we have watched keenly and how passionately you have followed the leadership. I urge you all to try to also emulate. It's a big shoe to step in quickly, but gradually, for it is a process. You cannot give what you do not have. Some are rich today. Some organizations could be richer. But to go out of the way to do this and give back to the downtrodden is a very bold step. For it might not give you castles on earth, might not give you the aeroplanes as required. It might not give you all the luxuries. But perhaps if we believe in the hereafter, it will give you everything. God willing, may those who give to this society and to the downtrodden enjoy everything in abundance in the hereafter. Today I stand before you to also passionately appeal to other religious bodies while appreciating the Redeemed Church to say, please, we can only support to augment what the government is able to provide. The government cannot do it alone. Please, I urge us all to put in either our religious requirements or responsibilities or our corporate social responsibilities, or as individuals. Nothing is too much. Even paying off a bill of the downtrodden that cannot afford goes a long way to save life, Today, ladies and gentlemen, standing before you, on behalf of the FCT administration and the entire people, resident and indigenous of the Federal Capital Territory, while saluting the bold step of the Redeemed Church and the General Overseer, we please call for the constant maintenance and required maintenance of these facilities provided. If we are not able to sustain and maintain what we have, then we will continue to buy and stock what we cannot use. Please, let's treat and use them with caution. I also call on all of us to see a way where we can have a round table to also reduce the cost of this process dialysis. It's well required, but it is not affordable for the downtrodden. I will not stop by appreciating Pastor Adegboye alone, but by telling us that the Redeemed Church and Pastor Adegboye has assisted in no measurable way to ensure that dialysis comes to the common man. It is domiciled in Wuse District Hospital to be able to also tend to the needs of the downtrodden, for they patronize these clinics. But the next is ours, my dear doctors, those in the profession, both technicians and medical and paramedical, to please, in the name of God, do the needful, call us on what is required on a round table with you, to ensure there is awareness that it is available here, and also to ensure that the maximum benefit of these dialysis machines are reached within the Federal Capital Territory, by extension being able to serve the downtrodden in the way it should. And that is the only way our most revered man of God and the Redeemed Church will also reap from the glory of God by lives we've been able to save. On behalf of all this afternoon, once again, I thank you all, and the prayers of those who live will be saved, through whose lives will be saved through the services of this center, with the reward from God Almighty to the providers of these facilities. Thank you all very much for listening. The Eno and Folu Adegboye Dialysis Center was commissioned to the glory of God by Dr. Ramatu Tijjani Aliyu, Honorable Minister of State, Federal Capital Territory, today being 17 February 2020 and in 2022, to the glory of God and the use of man.
This place was completely renovated, and all the other equipment
by the church.
By the complement with the lighting, and here we have 5 brand new machines, which we used to have, plus additional. Thank you so much. We cannot really.
I can see you are, all of us are happy. Our joy knows no bounds. If your profession and the nursing or medical profession is actually your life and your calling, the pain you will feel when you come down a patient is not quantified. Today we feel happy, we are relieved, and we say thank you to the Redeemed Church of God. And we also call upon you to try in your own little way, even without funds, by care and extra care beyond what even the paid services are, will go a long way to give succor to the downtrodden and heal the sick. Thank you all very much.
So